Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about recognizing stroke is Katharina Villanueva. Kat is the founder of Nest Care, a private duty in-home care agency providing companion care, personal care, and skilled nursing services to families in and around Montgomery County and Howard County, Maryland. For the past 15 years, she has devoted her nursing career to caring for patients with neurologic and neurosurgical conditions in the acute, subacute, and chronic phases. She has worked at Keck Medical Center of USC in Los Angeles, California, before moving to Maryland, where she exclusively worked with patients with stroke as a stroke program coordinator at Providence Hospital. How are you doing today, Kat?
I'm doing well, Jason. Thank you. How are you?
I'm doing very well. Thank you for joining us today. Looking forward to our conversation. Before we get started, for those joining us for the live webinar, if you have any questions, type your questions in. Time permitting, we will do everything in our power to get your questions answered. So, Kat, let's go ahead and get started. Let's focus on recognizing stroke.
Okay, thank you, Jason. I appreciate the opportunity to be able to talk about stroke. So, thank you guys for joining us today. Before I really go into the meat of this webinar, I wanted to build on why it's really important for us to be aware or, just learn more about stroke and recognizing the signs and symptoms of stroke. So first, I would like to talk about the stroke statistics. Every year, more than 795,000 people in the United States have a stroke. Really, that's a huge number. In fact, someone in the United States has a stroke every 40 seconds, and every 40 minutes or every 4 minutes, someone dies of stroke. So let's talk about that for a second, right? In the course of this webinar will be about roughly 30 minutes, and that's about 1,800 seconds. So in this 30-minute webinar, it's approximated that about 45 people in the United States will have a stroke, and about 7 to 8 will die because of stroke. So that's really a significant number. Stroke is the leading cause of serious long-term disability. So if you have ever known a patient that had a stroke, some of them may get out of it without, with full recovery, but a lot of them will have significant disability. In fact, stroke reduces mobility in more than half of stroke survivors age 65 and over. Let's talk about costs. Stroke-related costs in the U.S. came to nearly about $46 billion between 2014 and 2015. And what's included in this cost is typically, the medical treatment, the cost of medical treatment, the medicines that people have to take after they have stroke, and missed time at work. Stroke risk increases by age. So we know, and it's kind of like a known fact that a lot of older people are more at risk for stroke. However, stroke can and do occur at any age. In fact, in my career as a registered nurse working with neurological patients, I have cared for over 2,000 stroke patients directly and indirectly, and a lot of them are in their 20s, 30s, 40s, and 50s. So it can really happen at any age. In fact, even children can have stroke. In 2018, 1 in every 6 deaths from cardiovascular disease was due to stroke as well. So now I wanted to talk a little bit about some stroke facts. Stroke is a brain attack. So basically, the reason, or I think the main reason why they coined this as a brain attack is because medical professionals really want people to know that this stroke is a medical emergency. It's just like if you equate it with myocardial infarction or a heart attack, in heart attack, what happens is that you have a clot in your heart and your heart tissues start to die, right? In stroke, it's the same thing. However, the brain is the one that is affected. So there is a clot in your brain, and now your brain tissues are dying. Stroke can happen to anyone. We talked about that. At any age and at any time. So really, it doesn't choose any time. You can have a stroke when you're sleeping, when you're driving, when you're eating, when you're at work, when you're showering. It can happen at any time. 2 million brain cells die every minute during a stroke. 2 million every minute. So in a course of 1 hour, that's 120 million brain cells that die. So think about it. These brain cells really die, and there's no they don't regenerate. So once it's dead, that's it. It's dead. Stroke is the 5th leading cause of death in the United States. So it's pretty high up there. Number 1 is heart disease. Let me see if I can remember. Number 1 is heart disease. Number 2 is cancer. Number 3 is accidental death. Number 4 is chronic lower respiratory disease. Number 5 is stroke. I think 6 is Alzheimer's, and 7th is diabetes. So it's pretty high up there. It's actually the 4th leading cause of death in women. In fact, about 55,000 more women than men have stroke each year. So that's a pretty significant number. And African Americans are twice as likely as whites to have a first-time stroke. The good news is that 80% of strokes are preventable through lifestyle changes, and that there are medical options that exist that may reduce the effects of stroke if administered soon after the onset of symptoms. So let's talk about what is stroke, right? A stroke is a brain attack. We have said that, and it happens when there is an interruption of blood flow in your brain. And your brain cells then gets deprived of oxygen and they begin to die. Now, the problem is that, let's say, for example, so different parts of your brain controls different parts of your body and functions, right? So let's say, for example, if I have a stroke on this part of my brain, which is on this side, this part of my brain controls or is where my Broca's area is, right? My Broca's area is where is what controls my speech. So if I do have a stroke on this side of my brain, I will lose the ability to talk. I will be completely aphasic, or I will, I'll have slurred speech or just some speech difficulty. So depending on what part of your brain is affected by stroke, you will present with different symptoms. Now, in terms of the type of strokes, there are 2 major types of strokes. The first one is ischemic stroke. So ischemic stroke is the most common type of stroke. In fact, about 87% of strokes are ischemic. It occurs when arteries are blocked by blood clots or by gradual buildup of plaques and other fatty deposits. So if you look at this picture that I have here, you will see that this is an artery, right? And the yellow thing that you see on the side lining, the inner lining of this artery, are fatty deposits. Over time, they build up. And if you do have a clot that gets dislodged from somewhere else in your body, and it goes on through your general circulation, and when it reaches this sort of narrowed pathway or narrowed area in the artery of your brain, it can get stuck, right? So once it gets stuck in this narrow area here, there will be there will basically blood perfusion will stop. Blood flow will stop in this section, and your brain cells in that area will begin to die, and that's when stroke happens. Now, the other type of stroke is what we call hemorrhagic stroke, and hemorrhagic meaning bleeding, right? So this occurs when blood vessels in the brain breaks and it leaks blood into the brain. Brain tissues doesn't like to be in direct contact with blood. 13% of strokes are hemorrhagic. So as you can see, compared to the ischemic stroke, it's such a smaller percentage, right? However, hemorrhagic stroke is associated with a higher risk of death than ischemic stroke. So it's really fatal. Okay. So now that we've talked about, why it's really important for us to know about stroke and know about how to recognize them, and we'll talk. I'm sorry. Now that we know about, the importance of knowing about stroke and the types of stroke, let's talk about how do we recognize stroke, right? And really, it's really very, very simple. And this is going to be your takeaway for today is the word FAST, F-A-S-T. That's just what you need to remember when we talk about, recognizing the symptoms of stroke. So F-A-S-T, F stands for facial drooping or face drooping. A stands for arm weakness. S stands for speech difficulty. And T, it's time to call 911. So let's talk about that more. Facial drooping. So facial drooping, does one side of the face droop or is it numb? So when you look at this picture that I have here in front of you, you see a woman, and I ask the woman to smile, right? Ask whoever it is that you're trying to evaluate or assess to smile. Is the person's smile uneven or lopsided? So you can see here, this woman's face, you will see that she is smiling on one side of the face, but when you look at the other side, this part of her face is not moving, right? The smile is uneven and it looks lopsided. You look at the eyelid or the eyebrow here, it looks droopy, as well as the eyes. The eye here looks droopy. It's because there is loss of muscle movement in that area or loss of muscle control. And so that's why it looks, lopsided. The smile looks uneven. So that's one of the most common signs of stroke. F for facial drooping. Now we talk about A for arm weakness. Is one arm weak or numb? So what you do is you actually ask the person to raise both of their arms. And I'm going to step back here for a second. Ask the person to raise both of their arms. And the, normal is when they're able to raise both arms. But if the person is having difficulty raising one of their arm, or it really takes significant effort to, bring up their one arm, or sometimes they may be even completely paralyzed. They can't even move a finger, right? And that's something that's sudden onset, then that is really very alarming, and that you must consider that that patient could probably, or that person could probably be having a stroke. At that point, you don't even have to have other symptoms. If that is something that is sudden, it happened all of a sudden, and it's typically, with stroke, it's typically unilateral, so it's one-sided, then I would just call 911 right away, right? It's really a medical emergency. And I wanted to point out that with stroke, it's typically just, one-sided, unilateral, right? So basically, or typically, when you have a stroke, a certain part of your brain, gets the clot, right, or a certain part of your brain. So let's say, for example, that I have a stroke on my left brain here. The affected side or my symptoms will appear on the right side of my body only, right? Because your left brain controls the right side of your body, and then your right brain controls the left side of your body. It's contralateral. So when you have a left-sided stroke, you will see right-sided facial droop. You will see right arm weakness, or you could even see right leg weakness. So that's typically how it manifests. And then S stands for speech difficulty. Is speech slurred? So typically how you would assess this is that you would ask the person to repeat a simple sentence. Is the person unable to speak or hard to understand? If you look at the picture here, this lady is saying the sky is blue. But you can see how it comes out is she's saying buff fry flu. Buff fry flu. I am asking her to say the sky is blue. So you can see here that, she's having really some slurring of her speech. And if this is something new and it's sudden onset, then definitely think that, this woman may be having a stroke and that it's time to call 911. T is time to call 911. If the person shows any of the symptoms that we talked about, so it's F for facial drooping, A for arm weakness, S for slurred speech, even if the symptoms go away, please call 911 and get them to the hospital immediately. Do not wait. A lot of times, people wait people wait in the hope that these symptoms go away. Sometimes they go back to sleep and say, oh, I'm just tired, or oh, I'm gonna wait for my son to come pick me up, after work, things like that. No, do not wait, please. And also what I would advise is that do not drive them to the hospital. In the last 10 years, I've done a lot of community education. I've done a lot of community education about stroke awareness, and I've worked with actually a lot of the hospitals in Washington, D.C., as well as the D.C. Fire EMS, and we've done community education about stroke, recognition and awareness. And we always tell the community, please do not drive your loved one to the hospital. Because what happens is, and especially in this time of COVID and in this time of pandemic, when you bring your loved one to the hospital, what typically happens? You either park, you get to the hospital, right? You drive them, you get to the hospital, you either park or you drop them off the front, and then they need to get registered, and then you have to wait for the nurse to get their vital signs, and then they ask questions why you're here, blah, 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 and then they ask you to basically, sit down and wait to get triaged. 2 billion brain cells die every minute is what I want you to think about. Every delay, every time, every minute passes by, you're losing more and more of your brain cells. When you call 911, the EMTs come like immediately, right? The EMTs come immediately. They are trained to know how to test for stroke or know how to recognize the symptoms of stroke. And I know that because I used to teach some of their classes in the academy, the EMT academy. And so they know how to recognize these signs and symptoms of stroke, right? Once they do recognize that, the person may be having a stroke, there will be 2 follow-up questions that they will be asking. First is when did the symptoms start? And they want exact detail. What time exactly? 9:30, 9 o'clock, 10 o'clock, what time is it? it has to be precise, right? And then the second one is, I need a list of their medications. And really what they're looking for is, are they on any blood thinners? Because that's the information that the doctor needs. If you don't have that information, it's fine. We can get that information later. But the more important thing is that we need to get your loved one to the emergency room. Okay. All right. Other symptoms of stroke. This is what we call our sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. So we talked about that a little bit earlier. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or coordination. So we didn't talk about this earlier, but this is these are symptoms that that manifest itself when the stroke happens in sort of like the back of your brain here. So it's in your cerebellar area or your cerebellum, right? Because that's the one that controls your balance. It's very difficult sometimes to consider stroke in, like if you present to the emergency room and you tell the physician, oh, I'm dizzy. Stroke is really not like the first thing they would think about, but it's definitely a symptom of stroke if your stroke is in this part of your brain, in the back of your brain, right? So what they would typically do is they would, check your blood pressure, and if your blood pressure is elevated and you're dizzy and you're not walking straight, then they know immediately that, hey, this could be stroke, and then they could activate a code stroke or a brain attack in the emergency room. Sudden severe headache with no known cause. So this is really an emergency as well. I know a lot of people have headaches, but if you've never really had migraines or you've never really experienced, consistent headaches, and this is sort of like the first time, most people would describe it as, oh, I heard a pop in my brain, or I heard a pop in my head. Some would say, this is the worst headache of my life. When someone says that, it's definitely an emergency, because it could be a sign of a hemorrhagic stroke. And like we said earlier, hemorrhagic stroke could be fatal. Okay, so act fast. So please don't forget the takeaway for this presentation, the word fast, F-A-S-T. If you experience one or more of these symptoms or notice them in someone else, even for a short time, and even if it goes away, please call 911. One of the reasons I wanted to also emphasize the importance of calling 911 is that, when you call an EMT, right, and they recognize the symptoms, they immediately call the hospital emergency room saying, we have a potential stroke victim. Our ETA is 3 minutes. Our ETA is 5 minutes. So as soon as they hang up the phone, basically what the hospital will do is that they will activate their internal team. So they will do an overhead page in the hospital. And typically it's like a code stroke or a brain attack team, emergency room, brain attack team, emergency room, right? So everybody knows that there is a stroke victim that's coming or has arrived in the emergency room. And so typically what happens is that by the time your loved one gets to the ER, the team is already out there waiting for you, because they know that this is truly a medical emergency.
You mentioned a lot of the suddens. So would you say that many of the symptoms for a stroke are gradual, or most of them are sudden? So is this something that maybe somebody's having for a certain time period?
No. So basically, so to explain this better, what happens is that your blood is flowing, right? You have that clot that is just cruising and flowing because it's small enough. It goes through different arteries in your body, and then it goes in your brain. When it gets stuck and the blood flow stops, that's basically when symptoms starts showing because
Okay.
the brain cell is dying, right? And so typically stroke symptoms, they're very it's sudden. A lot of people are saying, like, or some of my patients, they're eating and then suddenly they drop their fork and then
Okay.
now they can't lift up their hand.
So some of the statistics you said, Kat, as far as women having strokes more often than men, are there common symptoms that are just for women when it comes to stroke?
Not really symptoms. Not the symptoms. A stroke is sort of it depends on where what part of your brain is
Okay.
affected, right? But women, they have more risk than men generally, and the reason for that is a lot of women have high blood pressure, and then life expectancy. The average life expectancy for men is 76, unfortunately, and but for women, the average is up to 81 years old. And if we say that stroke risk increases in age, that's when like more women get stroke. The other unique risk factor for women is that a lot of younger people are using birth control pills, and
Mhm.
postmenopausal, if you are on a hormone replacement therapy, um, coupled with smoking, that just increases your stroke risk exponentially. And it's known that 1 in 8 women actually smoke. So yeah, so those are sort of like unique for women.
You had said, Kat, that the 80% of stroke is preventable. So what can somebody do to prevent a stroke?
Yeah. So number one is that you need to know what your risk factors are, right? Do you have high blood pressure, or do you have diabetes? Do you have high cholesterol? Atrial fibrillation? Do you smoke? Are you a heavy drinker? And by definition, heavy drinker is more than 2 drinks per day for men, and more than 1 drink per day for non-pregnant women, because of course if you're pregnant you shouldn't be drinking anyway, right? So recognizing your risk factors, um, and really just trying to manage them. So say for example, if you have high blood pressure, make sure you take your meds, you limit salt intake, you monitor your blood pressure, things like that. If you have diabetes, then take care of your diabetes. um, with diabetes, I think it's really helpful for people to have diabetic nutrition education, because reading the labels in the back, of what you eat, right? There's like the nutrition label there. I think if you really know how to read it, it's really helpful to just making healthy choices when it comes to your food. So that's just it in general. And eat a healthy diet rich in fresh fruits and vegetables. Um, we can definitely, I mean, there's so much that we can do to prevent stroke. And at some point, we could do a follow-up talk about, prevention.
Yeah, we had already talked about doing that for February, so
Hmm.
that's for another day. I'm looking forward to that one too. But so
Right.
if somebody asked if I have a stroke, what are the chances I'm going to have another one?
So recurrent stroke is frequent. The statistics say that 1 in 4 who recover from their first stroke will have another stroke within 5 years. That's why it's really important that you know your personal risk factors and you act on them, right? Even, let's say, for example, a lot of people say they had a mini stroke. Mini stroke is sort of like the layman's term, but in medical terms, we call it transient ischemic attack, or TIA.
Hmm.
Basically, this is when you have symptoms and they went away after an hour, after a few hours, things like that. Um, for patients that had symptoms or had TIA, 10 to 15% of them will have a full-blown stroke within 3 months if you don't address the risk factors. Something caused you to have those symptoms. Now, you need to go, get evaluated. They'll do a lot of tests on you to find out what caused those symptoms. And that's what we're going to be treating or, working on so that you don't get that full-blown stroke. So consider that TIA sort of like a warning.
So you had mentioned the F.A.S.T, that you need to get to the hospital as quickly as possible. So what kind of treatment is available for somebody that just had a stroke?
Yeah. So there's a medication. It's an IV medication. It's called IV-TPA, or tissue plasminogen activator. It's basically a clot buster, and what it does is, or how it's it's administered, is that it can only be administered up to 4.5 hours from the time your symptoms started. So if your symptoms started at 10 a.m., they can only give you the medication up until 2:30 p.m. And that's the reason why we need to get you to the hospital right away, because there's still like testing that needs to be done and all that stuff. The other treatment that can be done with stroke who have a clot in any of the large vessels of the brain is it's a minimally invasive procedure where they put in a catheter in your groin. They thread it up to your brain, and then they're able to pull out or suction out the clot that's in that large vessel in your brain. So that's one of the sort of like the newer procedures that have been discovered, or that have been tried on for stroke treatments.
Very good. Last question, Kat. So if you have somebody who lives alone, what can you say to them to help improve their chances of survival if they have a stroke?
That's a very good question, because a lot of times when you have stroke, you may or may not have the perception that you're having a stroke, right? Because if your brain tissues are injured, and you're not the same. Your best bet is a bystander actually seeing or recognizing that you are having a stroke. That's a difficult question. It's really, I would say, having somebody like check on you from time to time, having a family member maybe constantly like calling you at a specific time of the day, and so when you don't pick up, then they may just come by and make sure that you're okay. Actually, one of my patients, they had that established with her son at 11 p.m. at night. Every night they talk on the phone. And so one time when he was calling and she wasn't picking up, it was like, okay, something is odd. So he went over, and true enough, she was having, it wasn't a stroke, but she was having some sort of emergency. She couldn't get up, she fell. And yeah, so establishing really these relationships outside, yeah.
Yeah, the importance of the caregiver or family member continually checking on their loved one, especially as they age and as they live alone. So, Kat, this is excellent stuff. How can people find you?
They can call our phone number 240-690-9900. That's the main line to our office. Or you can also look us up at nestandcare.com. My email address is kat@nestandcare.com. Also, I wanted to, if anybody is interested in, in this magnet, a F.A.S.T magnet, I'm happy to mail them to you for free. And really, as part of, like just me being a total advocate for stroke, I really want everybody to be educated on the signs and symptoms of stroke. And so, because it could save anybody's life, it could save your family's life, right? So if you are interested in having one of these magnets for yourself or your family members, just send me your email address, or no, send me your mailing address to kat@nestandcare.com, and I'll mail one out to you.
Yeah, and just make sure everybody knows, those that are listening, it's Kat with a K. So
That's right.
very good. And so, Kat, we had talked about a follow-up webinar in February. So I encourage everybody to kind of to get with the newsletter, to continually check with Kat and our website to see when we launch this webinar for February. For knowledgeable aging, our webinars are put on our website, also on YouTube. So if you go to YouTube, type in knowledgeable aging, I encourage you to subscribe. We're updating the YouTube page, 4 to 5 times a week with new content. If you like a podcast, you can check us out on Spotify, iTunes. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.